Adams had some information he wanted to present to the council members on behalf of the health department in regards to feral cats. So at this time, I ask Commissioner Adams to go ahead and take over.
Thank you, Member Martin. Mr. President, Mr. Majority Leader, members of council, and the guests that are here tonight, thank you for the opportunity to offer a few comments relative to the public health importance of managing stray and feral animals. If you don't know me, my name is Jim Adams, and I'm the Health Commissioner of the Canton City Health Department. I've been the Commissioner for the last 4 years. Prior to that, I was the Director of Environmental Health since 1985 with the department. I've been a registered sanitarian in the state of Ohio since starting my public health career in 1977. So, been around for a little while. I would like to think in that period of time I've kind of seen most things come and go, but we all know that every day presents its new challenge. Presents new challenges and a new set of opportunities to make good decisions. So today is no different. You've asked me to come here tonight to really address the public health implications of maintaining stray or feral cats in a managed colony program that is commonly known as trap, neuter, and release. Note that I'm not an animal control officer. I've not been trained in animal control, and I'm not an animal control expert by any means. So I don't have all the answers on how to best control stray and wild animals in our community. I can, however, help inform the decision-making process by pointing out some public health implications that may result in changes in policy. So tonight I'm going to be confining my remarks to issues of zoonotic diseases, which are diseases of animals transmitted to people, as well as some animal disease issues, transmission, and general nuisance issues. So let me start with some disease issues, first of all. We all know that cats, dogs, and other stray animals can harbor a variety of zoonotic diseases, which I pointed out are diseases that can be easily transmitted from animals to people. The number one concern that we have in our community is rabies. So we have a variety of rules and regulations already on the books that try to control the number of stray animals in the community, and the real purpose is to prevent the transmission of rabies to people. The most recent national report on rabies control was from 2010. Domestic animals represented about 7.9% of all the positive cases of rabies in the United States. Of the domestic animals, kind of stick with me here with some of these numbers a little bit. I know it's a little difficult to follow without a chart or something like that, but stick with me just a little bit and I'll get to a conclusion. Domestic animals represent about 7.9% of all the positive cases of rabies in the United States. Of the domestic animals, cats represent 62.2% of that total. So, of most domestic animals, cats are the ones that have rabies. 82% of the rabies that are identified in these domestic animals is called a raccoon variant of rabies. We're very concerned about raccoon variant rabies because in Pennsylvania and New York, it's the dominant form of rabies in that community. Ohio has had some noted effort in trying to beat back raccoon rabies from our community, mainly by an oral baiting program that's been going on since around the 90s. But the point is that New York and Pennsylvania account for about nearly of all thirds of domestic animal reports, with New York reporting a 55.6% increase in cat rabies in this last year, the most they've ever reported. So there is some indication that the amount of rabies in domestic cats is on the rise. We have little to no reported cat activity in Ohio. There's only about 50-some animals that were tested for rabies in Ohio. They have a fairly limited program. But of all the terrestrial animals that were tested, those animals being raccoons, dogs, things like that, all of them were positive for the raccoon variant of rabies. So, raccoon? Like the raccoon animal.
Oh, just like the one that's called
raccoon. So, we know that open feeding of animals and stray cats will attract raccoons as well as other potential urban pests. And then that would allow for this mixing of species to occur and the potential transmission of rabies between the two, so we're concerned about that. There's an issue of post-exposure vaccination for rabies. So most of us know that we have had some vaccine that you can get after you've been exposed to rabies that will hopefully prevent you from contracting the disease. And in most cases, it's quite effective. However, it is not something that you want to rely upon in order to prevent the spread of rabies. So each year in the United States, about 40,000 people get post-exposure treatment for rabies. Last year in Canton, we had about 22 people get post-exposure treatment. The average cost is around $1,000 or so. The concern I have is that if a volunteer in one of these trap, neuter release programs is exposed to rabies from a bite or a scratch, How are they going to pay for the post-exposure treatment? Who's going to bear the cost of that? A cost of post-exposure treatment is not just money, but it's also the risk of adverse reactions to the post-exposure vaccine. So all vaccines have some kind of adverse reaction to it. Why would we expose people to a vaccination process if we don't have to? Just a couple of other numbers I wanted to share with you for animal bites in Canton. In 2010, we had 229 animal bites that were reported to us. 38 of those were from cats, which is 12.7%. And that resulted in 2 post-exposure treatments from exposures to cat. In 2011, it's gotten a little better. 271 total exposures, 43 were cats, 15.8%. So the percentage of cats has gone up slightly. We had 1 post-exposure treatment resulting from a cat exposure. Some of the other diseases that we have of concern that can be transmitted from cats and from cats to man is a disease called toxoplasmosis. This has a potentially serious side effect, especially for pregnant mothers. It has been known to cause spontaneous abortions, and it can be transmitted from the mother to the child. So this is a fairly serious disease that we're worried about. Other ones that have some interest are a disease called cat scratch disease, or also known as Bartonella. It's a fairly common infection from cat bite or scratch. It has been known to cause encephalopathy, which is a swelling in the brain, as well as other side effects from this bacterial infection. Some of them can be quite serious. Other noted problems with exposure to cat waste is Campylobacter, which is a diarrheal illness, tapeworms, and hookworms. And I do have several studies that document hookworm transmission from coming in contact with fecal matter from the cats and causing this infection. There are some concerns about animal diseases also. Cats can serve as an unintended reservoir of animal disease that could be spread to other pet animals. Noted would be feline leukemia, which can be quite severe towards the pet. Another disease is called panleukopenia, which is also known as cat distemper. Also, there are problems with ectoparasites such as fleas and ear mites. So management of these cats in these colonies would serve as a reservoir for this disease, with an unintended consequence of pet animals coming in contact with these. I want to talk a little bit about some of the nuisance issues that we found with cats and also dogs, but mainly from cats, is they can tear open and spread garbage and trash throughout the community. I think council members have all had complaints about that happening, and we have verified that. They use the garden and sandboxes and other areas as a litter box, so their fecal material gets spread around. An interesting discussion, stick with me on this one, see if you can follow it, is they may contribute to the degradation of stormwater runoff. So you may know that the city has a permit from the Ohio EPA for the management of their stormwater drainage system. And so there are limits on material that can be deposited into the stormwater system, the systems of drains and gutters and things like that carry stormwater away from the city. One of the conditions of that permit is we have to take actions to control the amount of pet waste that gets into the stormwater system. So one of the reasons we have a nuisance program where we look at animal waste is to try to minimize that amount of animal waste that runs off people's yards and gets into the stormwater system. A violation of that would be a violation of the terms of our permit for this Phase 2 stormwater discharge permit. So a little concern there. We know that other problems that we've had with cats are noise and fighting with other animals, destruction of property such as gardens, flower pots, and other plantings. These have been pretty well documented. Feral cat is really considered a non-native species and is invasive. There are several studies that are well documented that talk about the destruction of native habitat and native animal species in the community. Management of cats in a colony may also encourage dumping of other animals because of the visibility of that colony. And introduction of managed colonies of feral cats really has an unknown effect on the environment. And it's been recommended that a full impact cannot be ascertained unless a study really is done about the environmental impact of introducing these colonies to a community. Let me talk just a couple minutes about some of the animal control policies that we currently have in place within Canton. There are several sections of the health code that talk about animals and animal waste and would apply to a managed cat colony. Currently, the health code does not permit the open feeding of animals outside. We talk to people about putting out bowls of dog food and leaving it out all day, bowls of cat food, leaving it out all day, feeding birds and things like that because it attracts other unintended species to there. Rats, raccoons, skunks, other wild animals. We have a section in our code that talks about manure and liquid waste stored so as not to contaminate land or water, which part of that is for that stormwater reason that I mentioned earlier. And also, we just don't want people's waste running from one property to another. We also have a series of rabies control standards within the health code that does require the vaccination of cats. City code, as you're well aware, has a requirement that you cannot have more than 5 cats or dogs or any combination of those within the community without a permit. And the idea from that, for those of you that have been on council for a while, we know that we had some real issues with hoarding of animals. And this was an attempt by council to control the number of animals that people could have to a reasonable number in order to kind of control those hoarding effects. And that actually has been, I think, quite successful. The state law and state code do also talk about rabies and rabies control. On the national side, the document that we mainly work with in trying to control rabies is called the Compendium of Rabies Control. And this is a document that was developed and put out by the National Association of State Public Health Veterinarians. And so they published a set of guidelines for vaccination of animals and control of animals in the community. And I just wanted to go over a couple of their long-standing recommendations. They have stated, and we have tried to implement many of these, they make several recommendations for a well-run rabies prevention program. One of those tenets is that any well-run program should have the removal from the community of stray dogs, cats, and ferrets, because they serve as a reservoir for disease. They recommend identification of dogs, cats, and ferrets to allow for vaccination of rabies status, and also to allow for the easy identification of stray animals. They also advocate for the registration or licensure of dogs, cats, and ferrets as an integral component of an effective rabies program. And I recall, I think council talked about that one time, you'll have to help me, was it 8 or 9 years ago? Maybe it was even longer than that, when council had considered a registration process for cats. All local jurisdictions should incorporate stray animal control, leash laws, and animal bite prevention and training of personnel involved with animal control activities to prevent the spread of disease. So one of the comments is that we've achieved the virtual elimination of rabies in dogs in the United States through a systematic program of animal control and required vaccinations, not by sterilization and releasing the animal back into the environment. It's interesting for me to note that we would not tolerate stray dogs in our community at all. I cannot imagine that we would ever have a conversation where we would say, let's capture dogs, sterilize them, and then reduce them and manage them as a pack of wild dogs in the community. I just don't think that's a good idea. In short, in conclusion, I'd like to say that the concept of managing feral or stray cats and managed colonies in the community really cannot be supported based upon good public health science. We know that they are a reservoir of human disease. We know that they can be a reservoir of animal disease. We know they destroy property. We know that it can promote nuisance conditions in the community. The Canton City Health Department cannot sanction the management of wild or feral cats in the community as managed colonies. The department further discourages the feeding of stray or feral cats due to the risk of attracting other nuisance animals. Any significant change in our current policies or practices for stray animal control should be made only after a thorough study is made of the environmental and public health impacts of the proposed change. Such policy changes should only be made after careful consideration of all available information and be based upon good science. So such a change of policy should not be entered into lightly. The unintended consequences of such a well-meaning action really can be significant. Yes, sir.
Would it be fair to say, based on your comments to council, that you do not favor a TNR program?
Not based on the information that I have available to me right now. I would not recommend doing that.